Thank you for this kind introduction, also for this invitation to talk here about tinnitus counseling. So as you heard, I'm CBT psychotherapist, so maybe it's a little bit overlapping with what we will hear for the CBT, but I want to talk about tinnitus counseling. I want to talk about practical considerations. So I give you a lot of tips or hints how to interact with patients, or what to have in mind if you are dealing with tinnitus. And one basic idea for this title, or for the topic of this talk, is how to counsel the tinnitus brain. So the framework is which we have in tinnitus counseling, that you always have to have in mind the brain. So we know that tinnitus is not only an ear disorder, we have an involvement of the brain in hearing processes, also in the etiology of tinnitus, and also in distress of tinnitus. And I think this is the basic framework we have in mind if we have to do with tinnitus. So maybe you notice these are the basic concepts of the tinnitus generation. That we have at the beginning of tinnitus a persistent or a temporary irritation at the level of the ear or of the hearing nerve, or with nerves like the trigeminal nerve, which is interacting with the hearing nerve. So we have this irritation, and then we have a neuronal compensatory mechanisms in auditory but also non-auditory brain areas. And this compensation sometimes leads to phantom perceptions to tinnitus. It's not the case in every patient with hearing loss, for example, but in some cases it happens. And you can imagine that it's like looking or tuning a radio for a radio station, and you manage it not very well. And in these cases, you will have some radio but with some kind of interferences. And this might be this compensatory approach of the brain to react to this hearing loss, to this irritation in the periphery. And maybe also the psychological aspects are also involved in the etiology, at least for, of course, for the decompensation, but maybe also in the initial generation of tinnitus. But this is not as clear. And so my basic consideration would be just have in mind that the brain is important in tinnitus. And we know this because there are a lot of models, a lot of neuronal models of tinnitus generation. I do not have the time, and I think earlier speakers also talked about this. We have the Jastrebow conditioning model, we have noise cancellation models, fear avoidance models. We have a lot of neuronal models taking into account the role of the brain. And interestingly, the things our patients tell us can be found in neuroscientific findings. So our patients tell us, I cannot concentrate. And this is an example for overactivated attention networks in the brain. Or patients tell us, tinnitus is a threat to my life. That means that the salience network have increased activity in the brain. So the patient's reports are fitting very well to these neuroscientific findings, and I think this is an important advice or important information we can have for our tinnitus patients, that we can really measure this patient's reports in a statistical way of meaning with neuroscientific techniques. So I think this is very important. There are also other hints for the role of the brain. So if you want to go into discussion why the brain is important, there are also other hints or evidence. And these hints are, for example, that not every patient with hearing loss has tinnitus. So if only hearing loss is responsible for getting tinnitus, then you do not really need the brain. That means that you can have hearing loss without tinnitus. That means that behind the ear there must be something, and it's the brain which is responsible for getting a tinnitus. These are these neural compensatory mechanisms. Or also, if we have patients with chronic tinnitus, and in these rare cases where we have a hearing nerve resection, maybe in context of a surgery of acoustic neuronoma, it may be the case that your thumb on this ear, you cannot hear anything on this ear, but the tinnitus is still there. That means if only hearing would be, or only the ear is responsible, then this tinnitus should also go away. But this is not the case. And there are also some other examples we can explain to our patients why the brain is so important for tinnitus. So the challenge, in my opinion, is that we have to raise awareness for the role of the brain. And as an attitude, I would say invite the handlers, not only the patients, to think about brain processes. So even if a patient with mildly suffering or no problems at all, you have to think that not only the ear is responsible, also there might be some untold brain reactions that the patients do not talk about. So please have always in mind the brain in tinnitus. But important, of course, is avoid the feeling that patients are a case for the psychiatrists. Even if the psychiatrists are mostly nice people, please avoid that every patient with tinnitus is a case for a psychiatrist. This is clearly not the case. There are also normal psychological reactions we can do in counseling, and it's not necessary that psychiatrists are doing a counseling. Yeah? Important for counseling is that psychological factors might influence the treatment effect. So even if you think at a simple treatment like doing acoustic stimulation or things like that, if you ignore the psychological factors, this might influence your effect. So imagine that this patient is attending to the tinnitus the whole day, the whole time, and you're doing a treatment. This will not work because the patients will for the whole time listen to the tinnitus, and this will influence the treatment. So think about psychological factors all the time. So this is the first issues I want to raise. Think about the brain if you are dealing with tinnitus, if you are doing counseling. So what is counseling? So I think this is the topic of the talk, of course, and we will write this down in one of the chapters in the next textbook of tinnitus, together with the colleagues John Searchfield and Maria Kleinstäuber. Counseling is the process of facilitating change by informing, advising, and empowering individuals with a need for support. So our aim is, or our task is, to help patients understand tinnitus and facilitate that coping with the condition. And the professionals who can apply it are psychologists, counselors, social workers, general physicians, nurses, medical specialists. But also in this context, I would say also scientists have to have in mind the definition of counseling, because I think even if patients are coming only for basic science, they might have in mind, okay, maybe I get some new information with respect to tinnitus and so on. So there are things going on in the brain of patients. So also for the scientists, I think it's very important to have these aspects in mind. And in my opinion, the aim would be that we have some kind of tinnitus literacy, that we empower our patients, and that we have in our contact with the patients some kind of health literacy. And health literacy is the ability to obtain, to read, understand, and use healthcare information in order to make appropriate health decisions and follow instructions for treatment. That we establish something like tinnitus literacy, that we can talk with the patients on equal footing, that we have informed patients, that we have informed handlers, and this, I think this is important for tinnitus counseling, that we establish a term like tinnitus literacy in the next years. And if you look at PubMed research or at literature, there are only 7 papers published who are dealing with the topic health literacy in tinnitus. So I think this is also a task for the future. So what are contents of tinnitus counseling? I will go through this list of contents by simple examples. So first, to see what are the aims, I think it's important in tinnitus counseling to provide hope, to depathologize. So it's a difficult word for me in English. So it's important that we do not see tinnitus as a severe disease, so that to get this perception as a normal perception. It is important to get some kind of habituation to this perceptive tinnitus. We want to reduce the avoidance behavior. We want to increase quality of life with counseling. We want to overall reduce the time tinnitus is perceived consciously over the day. So I think these are the aims for the counseling, and I will go through this list and explain in single examples why this what we should focus in counseling. So if we provide the definition, types, and assessment of tinnitus, if we say there can be different types of tinnitus, it can be on the left ear, on the right ear, in between the ears, in the head, it can be different sounds like, then we can counsel our patient that all kinds of tinnitus are normal. And I think this is important because some patients might mean my tinnitus is special and my tinnitus is especially dangerous. And this is not the case, because every type of tinnitus is normal and is possible. In my opinion, an important aspect is this temporary or intermittent tinnitus. So everybody of us know this intermittent tinnitus for some seconds or minutes, but for patients with chronic tinnitus, this is very, very annoying, and we should talk to them. This is very normal. Everybody knows this, or most everybody knows this, and this helps to depathologize tinnitus. So another aspect, of course, would be to talk about the disease model, about the theories of the etiology of tinnitus, including brain and psychological mechanisms. Also to talk about comorbidities like hearing loss, hyperacusis, sleep problems, emotional and psychological consequences. For hearing loss, I think it's very important that we talk also about the aspect that not tinnitus, but the hearing or the hearing loss is responsible that you do not hear very well, and in most situations it's in noisy environments. So a lot of tinnitus patients have problems in noisy environments, and it's rather a matter of distraction, not an aspect of tinnitus per se. I think hearing is the problem and not tinnitus per se, and this is important that this information is provided to our patients. Or if we talk about sleep problems, not tinnitus, the thinking about tinnitus and also the stress reactions. So if you're lying in bed and thinking about tinnitus and getting angry thoughts and things like that, we have stress reactions in our body. We are not relaxed, and without relaxation, we cannot sleep. So not tinnitus, the thinking and the stress reaction about tinnitus cause sleep problems. If we talk about the different treatments for tinnitus, we can provide the information. We can do something if we treat tinnitus, and this is important to provide hope. There are also specific trainings. I just want to go through it. So our aim in counseling might be that we try to get some habituation to tinnitus, that we provide relaxation techniques, that we do basic cognitive techniques, that we do attention shift exercise and the use of sound and hearing aids. I think also an important aspect is the self-help. So in all of my CBT groups so far, one main topic for the patients, or one main helpful thing for the patients, was that you have this self-help character of these groups, that you have an exchange with other patients in a safe and helpful environment. And I think this is very important also for counseling, to have this in mind, that self-help is important. And it's also in line with these considerations of empowerment, and also with this health literacy. We should also talk about tinnitus myths, misunderstandings. And one myth, for example, might be that people would say tinnitus is not a real perception. We know from these neuroscientific findings that we can measure it, not for each single patient, but in a statistical meaning. But I would compare it with itching. So everybody knows itching, but we cannot measure it. And only to say it's not real because we cannot measure it really does not mean that it's an hallucination. So tinnitus is a real perception. We can measure it and compare it with itching, and this will help to understand our patients that it's a real phenomenon. Yeah, and this is important, I think. There might be also a lot of additional tips. So I have only 20 minutes of time, so I can only go through it very rapidly. So there might be the skeptic patient who would say, independent of what I'm doing, tinnitus is getting louder. So important is ask for situations where tinnitus is in the background. And if you find one, and even it's only one single situation where the tinnitus is in the background, then you have the foot in the door. Then you can talk with the patient. So if this is possible for one situation, then it would be also possible for other situations too. Let's work on these situations. Yeah, compare the situation of a patient with famous persons. There are a lot of persons with tinnitus. So in my experience, it is also important to take the patient serious and talk maybe about a handicap. That is, say, living without tinnitus would be different as in living with tinnitus, and this is a difference. So take the patients serious. Compare it with other handicaps. So what would be happen if you have another handicap? How would you compensate for this, or how do you want to handle this? And it's your responsibility to cope with it. Yeah? Work with metaphors, etc., etc. So time is running. So why is important? Why is counseling important? I think counseling is in each case important because we can prevent suffering. So if we give the correct information, we can prevent worsening of the symptoms, and we can also avoid the induction of worsening. Because if we do bad counseling, so if we do a bad wording, this might induce suffering, this might induce worsening symptoms. You all know this from the textbooks, so it's important how to inform about tinnitus. Counseling per se is also can be seen as a treatment, and it could help specific kind of treatments. And we know from recent publications from colleagues which are also very experienced with counseling, the colleagues or the groups around Searchfield or Annick Childers in New Zealand, or also in Belgium, published recently papers where we could show that also very rapid or single counseling sessions are very, very helpful and very, very effective in the treatment of tinnitus. I'm not sure if Derek will talk about it, but there might be a difference between counseling and psychotherapy, because so to say, okay, when should be the psychotherapist be involved? I think the differences are counseling might be more general and psychotherapy more individual. Maybe also the lower the distress, the better counseling takes place. Or if you have comorbid mental disorders, it's a case for psychotherapy. Or also things like if one has the feeling distraction works well, but what should I do at night? So I think this is often conceptually very, very difficult, and I think this is a case for psychotherapy. Yeah? A general problem is, and maybe not only in Germany, that we have supply gaps. So we have not enough offers for counseling or also for psychotherapy in our health system. And maybe we can fill the supply gaps with eHelp. And I think this is very important also for our psychotherapists. Be open. Internet-based techniques can help our psychotherapy we are doing, and there are a lot of things we can find as apps, or in the internet we can find relaxation apps, biofeedback applications. We can help distract our patients using the internet or the smartphone. There are also specific tinnitus apps available, for example, counseling or CBT apps, especially for Germany, and also look for the correct internet-based information. Just to give you an example in Germany, so since this year, since January, it's possible that our insurances are paying for specific apps which are evaluated. So, and said since January, our patients can use some specific tinnitus app, and this is paid by the insurance. So things are going on. There is a process working. I think this is very, very important. That we have these applications in mind for the future, and our will be available soon, I think. Yeah, well, I know this. Yeah, so just to show you the situation in Regensburg, the eHealth situation. So we have a counseling app. We have also some internet channels and YouTube channels, our Tinnitus Science channel, or here in German, the Tinnitus Wisdom, or we will translate it also in this weeks into English, and we will call it Tinnitus Wisdom. So we will have some channels, some information, all, of course, also other labs or also other institutions around the world have this valuable information. And I think it is important that we use this information, that we get our patients informed about tinnitus. So this is just a screenshot of our explanatory videos of Tinnitus Wisdom. And just to sum up, and I think I have no time. It is important that counseling is very important in each context. We are working with tinnitus or tinnitus patients. So everybody who has to do with tinnitus should have these concepts, the psychological concepts in mind, even if you are a scientist, I think. Counseling might be the basis of all therapies, or should be the basis of all therapies. We have to inform our patients. And the basic idea of tinnitus counseling is the role of the brain. So think about that not only the ear, but also the brain is always involved in tinnitus. And the attitude should be on an equal footing. That's my talk for today.